Hello, my name is MD Mahadi, and this is my project on HIV/AIDS. To start off, what is HIV/AIDS? So, HIV, or aka human immunodeficiency virus, is a virus that targets cells and in the immune system. Over time, the immune system begins to fail, which is called immunodeficiency, and this increases the risk of infections and tumors that a healthy immune system would usually be able to defend off. These processes are referred to as AIDS, or acquired immunodeficiency syndrome. Now, there are two distinct type of HIV, which is HIV-1 and HIV-2. HIV-1 is the most commonly associated with AIDS in the US and worldwide. HIV-2 are more rare, typically restricted areas to areas in Western Africa and Southern Asia. HIV-2 is so uncommon that HIV is always referred to, almost always referred to as to HIV-1. So altogether, what is HIV? Human immunodeficiency virus is a viral infection that progressively destroys certain white blood cells that can cause acquired immunodeficiency syndrome, which is AIDS. And HIV can be transmitted through unprotected sexual contact with an infected person, or injection of and contaminated blood, which is using the same needle as someone else, transfer from an infected mother to a child before birth, during birth, or after birth through the mother's milk. Medical procedures such as transfusion of the blood that contains HIV, procedures done with inadequately sterilized instruments, or transplantation of an infected organ or tissues. HIV is a retrovirus, which means it carries a single-stranded RNA as its genetic material rather than the double-stranded DNA human cells carry. Retroviruses also can have the enzyme reverse transcriptase, which allows it to copy RNA into DNA and use the DNA copy to infect human or the host cells, and spreads throughout the body. Symptoms: within 1 to 4 weeks of infection, these symptoms may appear, lasting from 3 to 14 days, which is fever, rashes, sore throat. These are the most common ones: sore throat, swollen lymph nodes, and fatigue. After the first symptoms disappear, most people, even without treatment, have no symptoms or only occasionally have a few mild symptoms, and this period might last long from 2 years to 15 years. So, what are the stages to HIV and AIDS? Stage 1: acute HIV infection. People have a large amount of HIV in their blood. They are very contagious. Some people have flu like symptoms. This is the body's natural response to infection once the immune system finds a virus in the system, if you know what I mean. But some people may not feel sick right away or at all. If you have flu like symptoms or think you have been exposed to HIV, you should seek medical care and ask for a test to diagnose acute infections. Stage 2: chronic HIV infection. This stage is also called a symptomatic HIV infection or clinical latency. HIV is still active but reproduces at a very low levels. People may not have any symptoms or get sick during this phase without taking HIV medicine. This period may last a decade or longer, but some may progress faster through this process. People can transmit HIV in this phase. At the end of this phase, the amount of HIV in the blood called viral load goes up and the CD4 cell count goes down. The person may have symptoms as the virus levels increases throughout the body and the person moves into stage 3. By the way, people who take HIV medicine as prescribed may never move into stage 3, but I'm just saying. Stage 3, acquired immunodeficiency syndrome, which is AIDS, the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic infections. People receive an AIDS diagnosis when they develop certain opportunistic infections. People with AIDS can have a high viral load and be very infectious without treatment. People with AIDS typically survive about 3 years. Like, you have low chances to survive AIDS. Currently, there are no cure for HIV or HIV/AIDS. Once you have the infection, your body can't get rid of it at all. However, there are many medications that can control HIV and prevent it. These medications are called antiretroviral therapy, ART, or whatever you call it. You can call it anything you want, but yeah, prevention. Choose sexual activities with little to no risk. As I'm saying that if you're sexually active, try to have less sexual contact with other people to no sexual contact. And if you do so, use condoms the right way. Every time you have sex, get tested and treated for other STDs if you have so. If your partner has HIV, encourage your partner to get and stay in treatment, because this is the most important thing your partner can do to stay healthy. If your partner takes HIV medicine and gets and keeping an undetectable viral load, there is effectively no risk of you getting HIV from having sex with your partner. So, in conclusion, HIV is a virus that attacks the body's immune system, and if HIV is not treated, it can lead to AIDS, and there are no currently effective cure. Once people get the HIV, they have it for life, but with proper medical care, HIV can be controlled. And yeah, this is all I have. That's it. Yeah. Wrong button.